Welcome to Medical Bulletin. This is me, Anjali, with you. Headlines. Health experts says that the Ebola virus is going to last up to 6 more months. Nigeria takes measures to prevent the spread of Ebola virus in the region. Microsoft founder Bill Gates excels at the ALS charity Ice Bucket Challenge. Rise in CT scan on children and adults, says the health experts. Antibiotics in poultry scares carelites of chicken. Now, the news in detail. Health experts says that the Ebola virus, which has killed more than 1,000 people, has turned the parts of Western Africa into a battle zone and will last up to 6 more months.
In response to the growing concern over the Ebola outbreak, WHO has opened the Outbreak Coordination Centre in Conakry, Guinea. The centre is coordinating the work being done by governments, WHO and partner agencies in the 3 neighbouring countries affected: Guinea, Liberia and Sierra Leone. Cross-border collaboration is crucial in dealing with this outbreak. Kessine in Guinea is a border post on the river which serves as the Liberian border. People regularly cross the river for everyday activities. Today, Guy Minet, WHO logistician, has come to collect some specimens of suspected Ebola patients from Liberia.
On vient rechercher des échantillons du Libéria. On essaye de se voir, on se fait signe, et dès qu'on se voit, ils mettent les échantillons dans la pirogue qui traverse la rivière pour venir ici. Nous, on leur renvoie des échantillons vides, parce qu'au Libéria, ils n'ont pas de laboratoire, et donc on analyse tout à Gekedu.
The number of Ebola cases is increasing on a daily basis in Liberia, and the situation is extremely worrying. Every day, new cases are suspected, and their samples must be sent for analysis to the WHO laboratory, 10 kilometers away in Gekedu, Guinea. Time is precious. The WHO mobile laboratory in Gekedu was set up in collaboration with European lab technicians. The scale of this outbreak is unprecedented. It requires a global effort from all available resources and expertise.
Étant donné que là on est dans une épidémie d'Ebola, on est ici pour déterminer si les échantillons sont positifs ou négatifs. Donc, dans le cas, vu qu'ils sont peut-être positifs, c'est peut-être des échantillons qui sont extrêmement infectieux. Et donc, pour éviter les risques de contamination, il faut travailler dans ces espaces confinés pour éviter la propagation d'un échantillon qui est peut-être Ebola positif.
Experts sent from Europe are training the local people to take on this work. In less than 3 hours, we will know the results of these samples.
Donc une fois que l'expérience est finie, on vient regarder les résultats ici. Donc en fait, quand on a une courbe plate comme ça, c'est que le résultat est négatif. Et celui-là, on a une courbe qui apparaît, et ça, c'est un échantillon qui est positif. Dès qu'on a les résultats positifs et négatifs, on contacte les médecins qui nous ont envoyé les échantillons. Donc là, c'est des échantillons du Libéria pour leur dire quels échantillons sont positifs, quels échantillons sont négatifs.
Another very important element in the fight against Ebola is social mobilization. The local population is often reluctant to tell authorities when someone is sick in their village. There are many myths and misinformation. WHO is working with the Red Cross, UNICEF and other partners to inform communities.
Parce que la maladie, ce n'est pas seulement ici, ça peut être dans un autre village. Et comme les gens circulent,
6 villages.
Voilà, la maladie peut arriver là. Donc, ce que nous attendons de vous, on a compris la demande, et je pense que la Croix-Rouge a très bien entendu, que les gens vont continuer à venir pour sensibiliser et aider. Mais nous comptons aussi sur vous pour que dans les villages environnants, pour que nous puissions avoir la possibilité de continuer à venir appuyer, parce que pour éviter les résistances ou tous les problèmes. Ici, dans cette zone, la réticence des villages est liée au fait que les gens ont été surpris par la maladie et ont très peur de Ebola. Cette maladie qu'on appelle Ebola, elle fait très peur dans ces villages. L'autre élément, pourquoi les gens ont peur aussi, c'est parce que certains de leurs parents sont partis ont été amenés au niveau des centres de traitement et ne sont jamais revenus. Ça aussi, c'est des éléments qui font peur, qui font qu'il y a une grosse inquiétude autour de Ebola qui amène ces villages à de la réticence.
The task is not easy for the humanitarian agencies.
On est allé crescendo ces derniers temps où il y a eu de la violence. On a tagué les véhicules des humanitaires, on a cassé des vitres, il y a un humanitaire qui a été tué.
Et c'est quand on va le plus tôt possible au niveau du poste de santé ou centre de santé.
Once contact is made with the villagers, the humanitarian workers continue working with them until they understand what to do to protect themselves.
Une personne qui est décédée, il ne faut pas toucher le corps.
Ebola no makongolele. Ebola no makongolele banamya. Unoko wangi. Ebola sala ko wangi. O banda ni no makongo kawale sala ko wande. Memi me wana jona jobu baliga. Banumbadi mioma Ebola no makongole. Kani enjanze. Bisola bana chiolo nanduwa. Kani evenda no ke nandu chiolo. Midimunia.
Nigeria takes measures for the prevention of the spread of the Ebola in the region. Nigerian President Goodluck Jonathan has declared a national emergency to prevent the spread of the virus. Since March, the Ebola virus has claimed more than 1,000 lives in Guinea and the neighboring countries. Nigeria has recorded 3 deaths and President Goodluck Jonathan has declared the crisis a national emergency to try to prevent the spread of the virus. In its most populous city, Lagos, measures are being taken to deal with the outbreak, visible from the airport to street food stands. Microsoft pioneer and multi-billionaire Bill Gates doses himself in freezing cold water and succeeded at the ALS charity Ice Bucket Challenge. Those who take part in the Ice Bucket Challenge are required to film themselves dropping a bucket of freezing water over their heads before donating a small amount of money to their chosen charity. They must then nominate 3 friends to do the same within 24 hours. Those who forage the challenge must donate a larger sum of money to a good cause. Americans who take part are donating money to a motor neuron disease charity called the ALS Foundation, whereas in the UK, Macmillan Cancer Support has also set up a page encouraging people to take part and donate. Microsoft pioneer and multi-billionaire Bill Gates doses himself in freezing cold water after accepting a dare from Facebook founder Mark Zuckerberg.
I'm going to challenge 3 more people. Elon Musk, Ryan Seacrest, and Chris Anderson of TED. Consider yourself challenged. You have 24 hours. Good luck.
There has been a sharp rise in the number of CT scans in the UK, according to the health experts assessing the risk of radiation on health. The number of CT scans on children who are most at risk doubled over the past decade to 100,000 a year in 2012. The Committee on Medical Aspects of Radiation in the Environment estimated that the number of scans carried out each year reached a record of 5 million in 2013 to 2014. They estimate 16% of the radiation people are exposed to in the UK comes from non-natural sources, and some 90% of this comes from medical interventions. In the study conducted by CSE to test the residues of antibiotics in chicken, there were more than 40% of the chicken with antibiotics. Non-vegetarianism thrives in Kerala, but over the past couple of days, markets in the state have witnessed the strange phenomena of customers feeling less enthused by the chicken counters. Study says that it would lead the consumers of poultry to develop resistance to antibiotics. They could also fall prey to several other ailments, the report said.
When we consume the meat, the antibiotics enter our system and they do get absorbed into our body. And Consequently, some of the bacteria that live within our body can develop resistance to these antibiotics. Briefly, antibiotic resistance means that if you use a conventional antibiotic, then the bug does not get killed. It becomes resistant to it. It develops a way to get around the antibiotic and thrives without being killed or inactivated. So that is antibiotic resistance. Say you have a disease. The disease is caused by a bacteria, and you use an antibiotic to kill the bacteria. A smart bacteria, which is a resistant bacteria, will not get killed by the conventional antibiotic. Now that is antibiotic resistance. For one thing, we do not know if specimens or meat specimens from Kerala will contain antibiotic samples or not. The opinion from the poultry farmers here is that they do not routinely use antibiotics in poultry. So we can't really equate results from one geographic region to another.
The average daily consumption of chicken in the state is estimated at around 2 million kilograms. Reports indicate that the consumption has fallen drastically over the past few days to as low as 400,000 kilograms following the antibiotics in chicken scare. However, the sluggish demand for chicken has not yet reflected the prices in Kerala, with a kilogram of chicken still priced between Rs 100 and Rs 110 per kg. Headlines again. Health experts says that the Ebola virus is going to last up to 6 more months. Nigeria takes measures to prevent the spread of Ebola virus in the region. Microsoft founder Bill Gates excels at the ALS charity Ice Bucket Challenge. Rise in CT scan on children and adults, says the health experts. Antibiotics in poultry scares Keralites of chicken. That's all for today, and have a good day.